Tatiana Bito, Director of Aesthetic Content, and we are here at AAD 2026 in Denver with 4 esteemed dermatologists, Dr. Mary Lupo, Dr. Doris Day, Dr. Heather Woolery Lloyd, and Dr. Heather Rogers. And today we are talking about menopause, which is such a big topic right now. It should have been a big topic for years, but now we're talking about it so much more, and we wanted to get your input on what women should be doing right now to take care of their skin during this time, and what are the best treatments to undergo. So I'll just start by saying, what should women know about their overall health outside of their skin when they're going through this phase?
Well, I think women need to realize that menopause is a time of your life where things are changing, and I think it's important to realize that menopause, in my opinion, is very much interrelated with the concept of longevity and living well longer.
Right.
I think that's what we all want to achieve. And when we have this menopause time in our life, I actually think there's epigenomic changes that occur systemically in our body. And I think the single most important thing women do is be an advocate for themselves. Because if you leave the discussion of how to handle menopause to your doctor, it may get neglected.
And which doctor, right? Like, who do you go to?
Good question.
You know, when you first are seeing signs. What are your thoughts, Dr. Day?
Well, you go to many doctors, and I think the problem is that the symptoms are so nonspecific, and often it's us as the dermatologist that tells women that they're in perimenopause because they come in with the skin symptoms. Their hair is thinning, they say my face is falling apart, my skin is dry and itchy, or I'm breaking out like a teenager like I never did before. And then we ask them more questions. How's your sleep been? How's your mood? Are you thinking you're more bitchy, or are people more stupid? And the people who really laugh at that kind of know that that's like, oh, that's a sign.
Yeah.
So we put it together and we work with colleagues both in functional medicine and OB, but I think ultimately all doctors should be able to manage perimenopause and menopause because it affects every organ system, so it doesn't belong in one lane. We all should be able to manage it.
Yeah.
Yes, I totally agree. I think that especially in dermatology, we're definitely in a field where the symptoms of perimenopause and menopause are so visible. There was a study that showed that 100% of women who presented to a clinic that was focused on menopause had skin symptoms, 100%. So there is no one specific doctor to deal with menopausal symptoms because the issues with hair, with the skin are so common in women in menopause.
Yeah.
And I think in addition to that, it's about finding an advocate and a partner that we all have different symptoms, we all have different things that are bothering us, and so you have to decide how you're going to address those concerns. Is it weightlifting? Is it taking hormone replacement? But it is something that all women are going to go through. We're lucky to get to go through it, and so you just have to find a partner that will help you feel good about the choices that you're making.
One of the biggest problems in managing perimenopause and menopause is that doctors are not trained in it. So finding a physician who understands menopause hormone therapy, who doesn't just tell women, oh, get over it, it'll pass, and just tells people to not do anything. I mean, I think you talk about how you've been doing hormone therapy for over 20 years. I've been doing it for almost 15, but most doctors in our field and in medicine will tell women hormone therapy is dangerous, or you have to just do it for 5 years and then stop.
Right.
When in reality, that's completely wrong. So doctors need better education before we even get to patients.
You know, it was over 20 years ago when I went through my time, and I was fortunate because I knew that those studies that were used
Yes.
to tell women it was dangerous were extremely flawed studies.
Yeah.
And so I knew better. I was always my own advocate, but I tell my patients to be angry if they're not consulted, it's not discussed, because it is associated with morbidity.
Right.
Urinary tract infections in otherwise healthy older women can cause sepsis and death. Bone density decreasing from lack of estrogen causes falls and death.
Yeah.
Not to mention heart disease and dementia. So there are more pluses than minuses.
Right. And we talked a little bit about some of the symptoms already. What are the treatments that you are actually providing your patients right now?
Well, I would say starting with the basics, the most common complaint would be very dry skin and
Yes.
hair thinning. Those are the two things that, and I have to say, there's another one, new onset of acne. That's
Oh,
another
yes.
one
Yeah.
that we sometimes don't talk about as much. But so when you start with those, that's one of the more common things. And then there's the anti-aging or,
Right.
rejuvenation concerns. So it's really good to make sure that the patients are on the appropriate skincare. They're going to have to switch their moisturizer, most likely, because what you used when you're 32 is not going to work when you're 52, theoretically.
Right.
And the other thing is addressing hair thinning, which is a very common complaint for women, and you can do that with nutraceuticals, and we have so many things in our office that we offer, but those are probably the most common complaints that I see, starting with the basics.
Yeah.
I also think that in addition to the dryness, your skin just becomes incredibly more sensitive. Like there's not only is there less collagen, but there's less sebum production, there's more vascular sort of inflammation. People are having hot flashes, so people are getting rosacea in addition to the acne. So not only do you need a moisturizer that's more formulated like your natural moisturizing factor that has more squalene in it, for example, less petroleum-based ingredients, you also just need less actives in general. So regular vitamin C may not work for you. You might need the lipid-soluble form of vitamin C, THD. You might have to go from prescription tretinoin down to retinol. And that doesn't mean that these ingredients are less effective for you. It means that you're absorbing a lot of them, so a little bit goes a long ways. And so I think so often as we're aging, we're like, oh, we need more, but aging skin needs more but really tolerates less, and so you have to be selective about giving it fewer, higher quality options to work with.
I think one thing is that this is something that's done over time, because as your estrogen declines, your estrogen receptors go down, but your brain estrogen receptors increase because your brain is trying to grab any circulating estrogen it can get. So your skin is always sacrificing for your body and your brain especially to stay healthy. And you can lose up to 50% of your collagen in the first 5 years post-menopause. So what we do as dermatologists is we're focusing on the cellular level. What's going to support the fibroblasts, those cells that build collagen? What's going to help drive the skin thickness? And it's usually stacking therapies. So one is great skincare, as they've been talking about. Then it's devices that stimulate collagen gently, lowering the energy many times because you don't need the higher energy and the skin can't tolerate it. And then one thing I do for every patient after treatment is I use local hyperbaric oxygen therapy in the form of a carboxy mask. And that also drives the improvement. So it's stacking treatments differently in our older patients and in our younger patients.
Another thing I think is significant is the decrease in healing times.
Yeah.
And our skin is more fragile. And I think we all need to start thinking upstream with the problem of aging. The hot flashes are a symptom of your estrogen being low.
Don't get me started on the hot flashes. I think I might be having one right now.
But the wrinkle is really a symptom. The fragility of the skin is the symptom. It's upstream, and it's the aging of the fibroblasts and their ability to even respond to the things that we're trying to get it to respond to.
So it's so fascinating. When is a good time to just go in and start birth? we spend so much time talking about puberty, right? But we're in menopause for more than a decade, and we spend so little time educating women about it. So it's just very, I'm so glad we're at the place we are at now where we can have this conversation and where more people are talking about it, and it is at the forefront.
And the studies that came out 30 years ago were incredibly detrimental to this progress.
Yes.
But now, with additional conversations and education, I really try to get my motivated female patients to start thinking about what they can do proactively. How do we go into perimenopause with as much hair as possible, with as thick collagen as possible? And when you are premenopause, you can do an aggressive resurfacing laser at strong settings, but then as you age, you really have to pull back and do multiple treatments at lower energy. So I do sort of let's build everything we can until the estrogen starts to wane, and then we want to continue, but you just have to be more respectful and gingerly in that process.
One of the things is really having that holistic approach. So it's helping women understand, you mentioned it a little bit earlier, but talking about resistance training, the importance of protein in their
yes.
diet. Even the order in which they eat their food makes a difference, starting more with the proteins and having the sweets later to blunt those glucose spikes. Many of these patients go on GLP-1, so talking about maintaining their weight and not getting too thin and managing the weight changes. So there's so much that we do, but as dermatologists, we treat whole people, whole bodies, whole patients, mind and body, and that gives us great power. So we can help our patients stay healthy over time, and I always tell my patients, these are the best years of your life. You're going to be your most beautiful, your healthiest. It's work, but it's worth it.
Yeah.
And they appreciate it.
And then what is one thing everyone should be doing right now during this phase?
Oh, no. It is so multitasking.
Right.
Okay?
It's never one
so,
thing.
You know, so all right.
I'm glad you went first.
Okay. I'm not going to say, all right, look, I think if a woman is not doing one simple thing you can add to your routine that I think is hugely important is jump training, squat lifts with weights. Now, be careful if you have bad knees, but the sooner you start this, you're building muscle, you're increasing your metabolic rate. I think that is so important because I'm a big believer in the less people have to do exogenously, the better off they are. And I think we are, so we're talking about creatine, and we're talking about taking protein, but if you're not stressing those muscles, which not only help you in general, but they help build bones. So, that's what I think. This is the one thing, is get in the weights, but don't just lift the weights, jump while you're lifting the
Wow,
weights.
you're going to have me
Amazing.
jumping in the gym, Dr.
Jumping
Lupo?
in the gym. I agree, and also you're in a time of collagen decline, so protecting it. So what we take sunscreen and sun protection for granted, but this is a time where that's even more important because you
Right.
want to protect the collagen you have. But resistance training also improves collagen in the skin.
Yeah.
So everybody should be doing resistance training, and the younger you start, the better. But there was just a study that showed that when you start in your 40s and 50s, you get more benefits than for the brain, for dementia, even for the skin, than you do starting in your younger years. So if you're there and you didn't start yet, now's the time to start.
Never too late.
Never too late. And see your dermatologist. If you do one
Yes,
thing,
see
your
your
dermatologist and
dermatologist.
do whatever they say.
Yes.
So I totally agree with both of you because I really believe lifestyle is so important when it comes to addressing all of these things that occur during perimenopause and menopause. And just to add on to the resistance training is to train to failure, because the goal is to build muscle, and the way you build muscle is by training to failure. So sometimes you might be thinking, oh, I'm doing
Like
great.
reps.
Yes.
Yeah, but you really need to train to failure. So that's huge. See your dermatologist. That's another one, because I think that sometimes women feel so alone and isolated. And of all of the specialties, I do think dermatologists are honed in on this and more aware and more likely to kind of address someone's concerns. So I would say also see a derm.
And I think support yourself with rituals. Get routines and stick with the routines. And it's your skincare, it's your exercise, it's your sleep. And if you're not really taking care of all of those little steps, one thing isn't going to work. This is exactly what Mary said. It is about creating a routine that supports you. So you're putting on your sunscreen, you're using your night turnover product, you're exercising, you're sleeping, and you're eating well. And that does make it a really powerful time of your life where you're really in control.
I think the very last one I would say is having a good group of girlfriends.
Yes.
I think women, we need our girlfriends.
And
grandchildren. Oh my goodness. Grandchildren.
Keep us young.
Yeah. It's the best thing. But that social circle is really, really important. And you've reminded me of that by talking about the support. But it is about having a good social circle on top of it.
And then we're talking about this huge shift, right, where we're discussing this more. How have you seen this shift presented even here at the dermatology meeting this week?
I think the very fact that we're talking about it, Doris and I talked about it recently on her Serious Doctor show.
Yes.
I was speaking about this at the Dallas Cosmetic meeting. Everyone is beginning, it's like we have been the forefront, and then there's a lot of people behind us who are getting on the wave to ride, and that's a good thing.
Yeah.
That's a good thing.
Yeah.
The more we have engagement of all of the specialties, that women are no longer dismissed and they're heard. It's good for all women, and we're women.
Yeah, yeah.
No, I think you're right. I think it's hit that tipping point where in the beginning my colleagues would argue with me and tell me that this is ridiculous, it's not our lane, why are you talking about this? And now they're talking about it too. And now companies are coming on board and
Yes.
having ad boards. I was just in Paris and Galderma did a whole ad board with beauty editors talking only about menopause and about biostimulant. They have an agenda, but they have products to sell.
Right.
But they are telling the story and they're helping us reach our patients in meaningful ways. So I think we've hit that tipping point where you're a younger generation of women, the kids, the residents starting now in med school and in residency are really going to learn about menopause.
Yeah.
And it's going to be normal to talk about menopause and to treat it. Right?
Yes, I agree. And the other thing that I've been seeing a lot of is at this meeting is longevity.
Yeah.
And that, we just were at a session where that was a hot topic. And I think that in general, we want to live longer, but we want to live longer in a healthy way to have a great health span. And we also want our skin to be healthy, we want our hair to be healthy as it can be. In general, one of the reasons why I think menopause is getting its moment right now is because we're living longer.
Yeah.
And I love
Yeah.
that you said, someone said we're lucky to be able to go through it. You said we're lucky to be able to go through menopause. I always say every day is a good day. We're fortunate, and so longevity is a big piece. So living as healthy and as in a positive way for as long as possible, physically, but also for your skin and hair.
I agree. It's just part of the journey, and I think it's wonderful that it's getting the attention it deserves. And I do think that, at least for me, there's a lot of noise in beauty in general, and it is our job to sort of help people identify what of those things they're worth doing, what they're worth spending their time and money on, because a lot of it is common sense. It's what we already talked about.
And it's such a wonderful time in our lives, right? Because you've worked so hard, we're accomplished women, and all of these concerns can sometimes bring you down a little bit. So it's wonderful to be talking about this with all of you and getting your insights and knowing that there are options out there that can help us through this time. So thank you all for your insights and for coming and joining New Beauty and always being great resources for us. So thank you so much.
Thank you.
Thank you.